Good morning, everybody. Thank you so much all for joining us. I'm Chris Quinn, the president and CEO of WIN. And I really do want to thank this group for joining us, because it's not every group of people who get up in the morning and say, the first thing I want to talk about is mental health and the mental health problems of homeless mothers and homeless children. So we thank you for being this committed and this bold. You're going to hear in just a few minutes from a panel of individuals who are leaders in the work at WIN. Our panel is going to be facilitated by our terrific Vice President for Policy and Planning, Dr. Henry Love, and he's going to take us through why we need to have this conversation and why recently, I'll talk more about that later, did we at WIN need to go to the City Council, ask them to pass legislation around mental health issues in family shelters, and how glad we are that Councilmember Eric Bottcher, who's joining us this morning, was a leader in that effort, and we were able to get that piece of legislation passed into law. It's important for folks to know that 80% of the mothers at WIN had been in some type of shelter situation before they came to WIN. So they have history of unstable housing. Also, the vast majority of the mothers at WIN have a domestic violence or intimate partner violence background. All of that together creates a very challenging mental health situation. We know that giving birth and postpartum depression, even if you are a housed person, can have a very debilitating impact on someone. And actually, there's data that indicates that women who have had postpartum depression have a higher rate of becoming homeless. This is on top of the other mental health issues that go along with eviction, sexual assault, child abuse, all things that our moms have suffered, and in many cases, our children have often suffered. But we've not been able to really provide the services we've wanted, which is why the legislation we passed is so central. You'll hear more from our Assistant Vice President, Morgan Ortiz, about how long she and her case managers have to wait sometimes, months and months, before clients can even get an intake appointment. 20% of the people who are at WIN every night, so 20% of the over 5,000 people, are 4 years of age or younger. They're in a brand new place. They don't know people. They could be quite far from where they used to live. And we need to recognize the immediate and long-term impact of that trauma on them. They usually show up at WIN in every shelter in the middle of the night, intake having taken the whole day, and inappropriately sometimes more than one day. So we're really glad you're with us this morning to hear not just these unpleasant and really truly unfortunate statistics, but also to hear how we are addressing them at WIN, good progress that's happening, and what more you can all do to help us get even further. And I'll just end by thanking again Councilmember Eric Bottcher and our policy team, particularly Christopher Mann, for getting Local Law 35 passed into law and signed by the mayor. It mandates that the city fund mental health services in family shelters. Now, you all just scratched your head and said, how could that not have been the case? But it was not the case. It was not the case. We had to refer out. And in one case, and in many cases, that could be a wait as long as 3.5 months. So that is going to be put to an end next year. We'll have phase 1, and then we'll phase in the rest of the shelters. So let me now turn it over to Dr. Henry Love, our Vice President of Policy and Planning. And, Henry, I just want to say, is doing a terrific job. Not only did we just pass Local Law 35, I don't know, 2 months ago, maybe 3 at the most. Just recently, we passed, maybe last week or the week before, another package of groundbreaking legislation, which will make you come back for another webinar to talk about. But the work never stops. Just as the reality of what our family is going through never stops, Henry takes that into his work, and his team, their work never stops. So Henry is going to be our moderator for the morning, and I will throw it over to him.
Thank you, Chris, and thank you again for the kind words. Everyone that's here today, thank you so much, as Chris said, for joining us on an early morning to talk about this really important issue of behavioral health as it is concerning our families that are in shelter. And I just want to give a little bit of context and give you a little bit of framing about WIN's position in this and sort of how this even came to be. And so, I think the really important thing to note is, as our size as the city and the nation's largest provider of homeless services to families experiencing homelessness, we serve almost about 14% of the population in New York City alone. So when we see issues across our shelters, it's significant. And so, it's not that we're seeing these one-off cases. Because of the size and the magnitude of the folks that we serve, we really have a sort of system-wide understanding of sort of what's going on. And, a lot of these concerns regarding mental health, of course, they're coming from, our direct care staff, which Morgan will talk a little bit more about in a bit, but also from the clients themselves. And so one thing that's really important for us here at WIN is listening to client voice. And so out of a series of client insight groups and sessions, one of the issues that was most concerning was access to mental health cares and shelters. And this isn't surprising, right? Because we know that we're currently in the midst of one of the greatest mental health crises we've ever seen. The Surgeon General put out an advisory a few years ago, post-COVID in response to youth and their issues, but also general populations as a whole. And so, we've been dealing with these issues prior to the pandemic, but everything was, of course, exacerbated. And so, one of the big issues is the episodic nature of mental health and services. And so, it's very uneven and sporadic. So there's some, shelters that have absolutely nothing, and some that maybe through, private fundraising, et cetera, are able to have some ability, but it's not something that's standardized across, as Chris has mentioned, and you'd think it would be. And just quickly on a few statistics that really drive home the severity of this issue in our shelters, and that is that homeless women and children are 2.5 times more likely to meet the criteria for major depressive episodes and 3 times more likely for PTSD. And, the other thing I'd like to emphasize is that, one of the things that we talk about in WIN Academy, our trauma-informed internal training group, is that when we talk about how many of our families have experienced a traumatic incident, it's about 100%, because becoming homeless is traumatic in and of itself. And so when we talk about children, though, school-age children experiencing homelessness, which is a huge population that's often not discussed in the literature or a lot of times in policy circles, is that there's clinically significant symptoms of mental health disorders at a rate of 2 to 4 times higher than their low-income housed peers, and up to 3 times more likely to experience PTSD. So all of this, again, is in the midst of an ongoing mental health crisis that we've seen at the national level, at the state level. And although the majority of our families in shelter receive some kind of screening for their health needs, and this is prior to 2022, again, to Chris's point, shockingly, less than 1% of families referred for treatment were able to attend an appointment between January and March of 2022. And again, Morgan will talk a bit more about what that is actually like on the ground. So to support families experiencing homelessness, WIN was able to work really closely with Councilmember Bottcher to introduce Intro 522, which is now Local Law 35, which requires the City of New York to provide mental health services on site in every single shelter for families with children at a ratio of 1 full-time provider, which is equivalent for every 50 families. So this legislation is really groundbreaking, and it'll make mental health care accessible to more than 15,000 families, including almost 27,000 children, where and when they need it most, when they're in crisis in shelter. So with that being said, I want to shift gears a little bit, and I'm really excited to introduce this really esteemed panel of experts to discuss the importance and the impact this law will have. Please feel free to put your questions in the question and answer function, and we'll get to them in the very end. So with that being said, I'd like to start with introducing Ms. Morgan Ortiz, who's our Assistant Vice President of Transitional Housing, and she oversees 5 of our shelters. Chris Quinn, who needs no introduction, our President and CEO of WIN. Councilmember Eric Botcher, who's been a steadfast champion on these issues of mental health concerning incredibly vulnerable and marginalized populations. Councilmember for District 3, which also happens to be Chris Quinn's former district. And Chris Mann, our Director of Policy and Advocacy, who was charged with advancing with WIN's policy work and has really been leading our efforts to pass these pieces of legislation in the council, but also the package of bills that Chris just mentioned, and stay tuned for an upcoming webinar on that. So with that being said, I'd like to start with Morgan, I'm sorry. There's lots of Megans and Morgans. With Morgan, as you are in the front lines, what are some of the challenges that clients face when trying to access mental health care? Can you please share some examples with us?
Definitely. Good morning, everyone. So we definitely have seen the same pattern over and over again when clients are requesting mental health services and we're referring to our community partners, and their wait list has been about 3 to 4 months long. And that's just for an intake appointment. So that's not even the introduction to like therapy or the assessing. That's just an intake appointment with the intake coordinator to get all the demographic information. So we've definitely seen that these wait lists are significantly long, especially somebody who's going through a mental health crisis. We know how important it is for them to be seen right away. We had a family, a mother of 2 very young children that was displaying some symptoms of major depressive disorder and really was at the point where she wanted to get into treatment for herself. She was able to recognize her symptoms. And it took a very long time for the team to get her to that point where she was able to kind of like normalize the mental health and identify and have insight into it. So we really needed to act in that moment. We reached out to multiple community organizations and their wait times were about 3 months. So we put her on the wait list for that. In that time, she was definitely struggling with her mental health. What we ended up doing was constantly calling other providers to see if there was a cancellation. Luckily, about 2.5 months later, we were able to find a provider in a different borough who had a cancellation on the same day, and we were able to get her in. And that was after 2.5 months of waiting. But also the wait times are a barrier, as well as transportation, right? And being able to commute. So she had 2 young children. Now she had to go from Brooklyn to the Bronx, and being able to kind of still make sure that all the services for her children were in place, that she had childcare and she had all the supports necessary.
Thank you, Morgan. And just want to shift gears a little bit to Chris. WIN offers holistic services, and then there's our advocacy work. How does this work that we've been doing with the mental health bill in the intro, how does this fit into the overall mission of WIN?
So, there are a lot of great groups out there who do social service, and there's good groups out there who do advocacy. But my belief is that the best advocacy is fueled by the real life lived experience of whoever the group or whatever the issue is you're working on. So in this case, yeah, Henry and I could sit around and talk about what we think homeless mothers need, but neither of us are or have ever been a homeless mother. It doesn't work. We at WIN, and this was so important to me 7 years ago when I took the job at WIN, we are the largest provider, as has been said, of shelter to homeless families with children in the country. Now, these families come to us, and throughout the process, it's a little bit like peeling an onion back. You go through layers, They honor us with their stories, with what has happened to them. I remember asking a woman once, do you mind telling me how you ended up at WIN? And she said, no, I've been living with my boyfriend, and I realized I had to leave. And she kind of went through it. It was clear the boyfriend was dealing drugs. I had to, get out for the protection of myself and my baby. And I said, do you mind if I ask, did he ever abuse you? And I'll never forget it. She cocked her head and she put her hand on her cheek and said, does the time he choked me till I passed out when I was pregnant count? She didn't even know if it was domestic violence, but she took this huge risk to share that with me. And when she shared that with me, it gave us at WIN information, data, facts that we have an obligation to turn into advocacy, to not only help her, but to try to make sure nothing like that ever happens to her again, and that we reduce the likelihood of that happening to anybody out there. So at WIN, we will never just collect data for the sake of data. We will do it always to put into action what we know that clients need. Now, our contracts with the city, you've heard a lot about the mayor trying to get rid of the right to shelter. Well, that has not happened yet. And the right to shelter triggers us and others getting contracts to provide services. But what we get in those contracts is the floor. The ceiling is the needs of our clients. Intro 35 was driven, local law 35, by the need, the mental health need. But we believe all services have to be delivered in a holistic, wrap-around way based on evidence-based practices and trauma-informed care. What the hell is Chris Quinn talking about with trauma-informed care? I'll give you one example, perhaps my favorite example. We all had coloring books when we were children. Coloring books are very rigid. If you're in the lines, you're right. If you're out of the lines, you're wrong. Children who have been in abusive situations sit around thinking, if I was just better, if I was in the lines, the battering would stop. So we don't have any coloring books. We have white pieces of paper and you draw and send whatever message that you want. Small example. Now, we're thrilled with Local Law 35 and the resources it will bring us. But you can't just have a psychologist on site or on telehealth that somebody goes to see. That's not enough. It has to be holistic. It has to be everywhere and wraparound. And that is a way that you can help, lest you thought we didn't have more for you to do. We always do. And I'll give you an example. A $50,000 donation could pay for a series of dance therapy sessions for 10 children. Dance therapy might be what the psychologist on staff or consultant thinks that that child needs. $50,000, a series of dance therapy sessions for 10. I'm so sorry, I got this wrong. The dance therapy is $5,000. A entire wellness program like we have at one of our shelters, that's $50,000. I was thinking, well, those are some good dancers. $50,000 is a wraparound holistic wellness for a whole shelter of about 175 units. Dance therapy would be $5,000, and $500 covers an art therapy pottery class for 10 children. So those are just some examples of how you can help us take mental health work even further, particularly for the children. Because if you're a homeless child, the likelihood you are going to become a homeless adult is off the charts. So let me throw it back to Henry. Now that I've asked you for $5,000 to go dancing, but it doesn't seem totally out of character.
So I just want to emphasize something that Chris said, because I think I don't want this to go unrecognized in this work and how we're doing this as a team and what makes WIN so unique. Our team, our research evaluation team just got done doing a series of client insight sessions similar to what happened prior to this sort of happening with the round for this bill. And I think what's been so amazing about those findings, even, this is a year and some change past the first round that we did this, was clients want mental health supports. It was overwhelmingly something that we saw across the board. And it's not like I'm a qualitative researcher. And so, like Chris said, stories are data. And too often folks are separated from that. And I think it's been really powerful to witness, coming from, clients in our shelters to bringing something alive in legislation. And I think that's a great segue for our next guest, Councilmember Bottcher. So, Councilmember Bottcher, what is it about this issue that really has resonated with you? And why did you choose to work with WIN on this legislation?
Thank you so much for having me, Henry, and thank you, Chris, for this invitation. I'm gonna give 3 reasons why I've really chosen to focus so much on mental health as a council member. I've been very open about my experience as a survivor of suicide attempts, as someone whose life was saved by mental health treatment. When I was 15 years old, I spent a month in a mental health hospital in upstate New York, a place called Four Winds. It was an involuntary stay, but during that month, I got individual therapy, group therapy, family therapy, medication, and then that treatment continued with individual therapy and medication. And it's antidepressants that I take to this day. And it's the reason why I'm alive today. And it's absolutely the reason why I'm a council member today. I certainly wouldn't have, I just don't think I'd be here today. But the treatment that I got is exceedingly rare for people in this country, especially if you're a person living near or below the poverty line or a person of color in this country. And that is just so wrong. Also, as a staffer in the city council, I've been before I got elected last year, I was a staffer, starting with Chris Quinn, Speaker Chris Quinn, 2009, and then as the working at the state, and then as the chief of staff for my predecessor, Corey Johnson. One of the issues that we've struggled with so mightily in our community is the mental health crisis. And it's just been one of those seemingly intractable issues that we work on every day and that we get calls about every day from constituents. You know, if there's like an overflowing wastebasket, we could have that taken care of. If there's like a tree pit that needs to be filled, or these other issues, or if we need to like redesign a road. But when you have this national failure on mental health that's affecting our communities so much, it needs to be addressed. These fundamental policy failures need to be addressed in order for us to make progress. And then as a New Yorker who walks down the street and sees people suffering from untreated mental illness on the street, we're so much better than this as a city. And it just breaks my heart as a New Yorker that this is where we are and how badly we failed, and the amount of pain and suffering, needless pain and suffering. So as a council member, I've had the honor and privilege of getting to work on this issue. And over a year ago, I attended a panel discussion that was hosted by WIN, and it was down at the UFT headquarters on Lower Broadway. And in that session, in that panel discussion, the issue was raised of the lack of access to mental health treatment by families living in homeless shelters. And we spent the last year, my policy team and I, working with Chris and Chris Mann and you and everyone on this legislation, and legislation that would require the Department of Homeless Services to offer on-site mental health treatment in all family shelters. And we did meet a lot of resistance on that issue from the administration, saying it would be too expensive, and we just don't have the amount of social workers or the amount of mental health professionals that we need to make this happen. But we were able to craft legislation that not only accomplishes the goals we want, but is actually doable. And I'm a firm believer that you really have to make legislation that can be executed. And that's what this legislation can, with the embrace of telehealth we've got a piece of legislation that I believe really will put these services in all shelters. And it's so important because the average amount of time, the average delay between when symptoms, mental health symptoms first appear and intervention is around 11 years. And we know that to prevent serious mental illness from setting in, you need early diagnosis and treatment. So we're not only going to be preventing pain and suffering in the immediate, we're going to be helping to prevent the onset of serious mental illness. That's the only way you can do it. You can't just give treatment to the people who are already in the throes of serious mental illness. You have to have early diagnosis and treatment.
Thank you, Councilmember Bottcher, for all of that. Super important. And I just, want to switch really quickly to Chris to ask this last question, because Chris has really been, again, closely working with the council members, legislative team, and really getting this across the finish line and in the weeds. So Chris, man, there's lots of Chris's. Why this topic? Can you tell us a little bit about how WIN identified this need, and sort of how did the final legislation come together?
Sure. Thanks so much, Henry. So this has been alluded to a couple of times already, but WIN uses these insight sessions to really guide our policy work. So these are innovative trauma-informed focus groups where we meet directly with clients and frontline staff to really inform our policy agenda. And as the council member mentioned, out of those insight sessions, we hosted a policy breakfast in March 2022, and that's really where this conversation began that led to Local Law 35. And in terms of how the legislation really came together, WIN worked with a pretty broad coalition, more than 20 groups to gather input and feedback on what the legislation should look like. And this was like multiple rounds talking to groups, getting their feedback to make sure that we got this right. And so, as Councilmember Bottcher pointed out, like we wanted to make sure that this was actually going to be implementable. And so through all of that work with our coalition, I think we really developed a bill that is super strong and is going to achieve the goals that we sought to achieve starting out. And I also just want to shout out NAMI, the National Alliance on Mental Illness, who was an incredible partner on this. And then obviously, Councilmember Bottcher, just an incredible champion on this issue. So I'll leave it there and we'll, I guess, open it up for Q&A.
Thank you, Chris. So the first question is actually probably more geared towards you, Chris, and I think, anyone else, feel free to jump in. How is the bill being rolled out and how much is it going to cost?
Sure. So the bill is being rolled out in two phases. So the first phase will require that there's clinical mental health services on site in the 30 largest shelters for families with children in New York City. And that is required by the law to be rolled out by July 2024. And then the next phase requires that clinical mental health services are on site in all family shelters throughout the city. And that's by July 2025. So we expect that the first phase will cost around 12 million and that the final implementation would cost around 40 million. So, working with the council to make sure that, we have the resources needed to fully implement.
I don't know if Chris or Eric, if you wanted to hop in.
Well, I just want to say people may make 40 million may or may not sound like a lot of money, but one, it is going to reduce hospitalizations, right? It's going to enable people to stay in shelter as opposed to go into inpatient care, though when they need to go into inpatient care, they will. Two, it's going to help people once they get out of shelter, not return to shelter. Because if you have untreated mental health, it's almost impossible to remain housed, particularly if you're low income, but anyone. And that it is much cheaper. Right now, it's $72 a night to live in a permanent apartment building, a permanent home with a housing voucher. It's $188 a night to live in a tier 2, that's the technical name for a WIN shelter, and paying the most and getting the least, it's $383 a night to live in a welfare hotel. So this is an outlay that's a humanitarian outlay, in my opinion, but it is also a fiscally responsible amount of money. And is 40 too much, too little? That's, we'll learn as we go through this. And we're lucky to have great partners like Eric and Speaker Adrienne Adams and Deputy Speaker Diana Ayala, who will work with us moving forward if we need to. And I'll just tell a funny story. Eric asked a good question, what if the mayor doesn't implement this law? Because we didn't know for a while whether he was going to veto it. And I said, well, if they don't implement the law, we'll sue them. We'll get a lawyer and we'll sue them. And Eric bumped into my wife. We all live in Chelsea, walked down the street one day, and my wife is a lawyer. And Eric said, Chris said, if they don't implement it, we'll get, that she'll sue. And Kim walked in the house and said, tells me the story, and then says, and remember, I'm not that kind of lawyer. She's a corporate litigator. I was like, you could learn.
I love that. I was wondering, I figured Kim would tell you that I said that when I bumped into her. We live a couple blocks from each other, Chris, Kim and I. New York City spends billions of dollars every year. I think we spend like $2.4 billion on homeless services last year. We spend unbelievable amounts of money on our correction system, our public hospitals, emergency hospitalizations. That amount of spending is necessary because of our failure to help prevent people from going into these systems. And the only way to help prevent people from going into our homeless shelter system, into our correction system, into our emergency hospitalization system is to diagnose and treat a lot of these issues early on. And that takes resources. And we have to do more than just talk about it, because everyone agrees that that's true. We have to do more than just talk about it. We have to put resources behind it and actually do it. And that's what this is.
Yeah, and Councilman Rabacha, that is such a great point. And I think we often are so concentrated on the front end price tag and are not thinking about what are the long-term cost savings of this. And not just cost savings, but just like it's the morally right thing to do.
But also just another, it's hard to quantify. And quite frankly, I don't think it's worth the effort, but think of how much you're going to save on special education and those kind of interventions, juvenile detentions, et cetera, by dealing with the children's trauma of shelter, up front. And one of the things that when we talk about holistic, we have childcare centers in our shelters. Those are based on trauma-informed care as well. But there's a real sense of when mom gets there and has to go through with staff, what happened? It sounds small, but it doesn't happen in every shelter if there isn't childcare. Let's get the child not to sit right next to mom, as she has to tell the case manager all of the things that happened. And A, that prevents that trauma of hearing all of that. But B, it creates a moment where mom sees someone she can trust, who can take her little one, and everything's going to be okay. And that's really important towards longer term growth.
And Chris, I think that's a perfect segue for this next question. I just want to highlight a quick story about, like, as we've been doing these, our lead clinics for our asylum seeking clients and families, how critical that child care piece has been, exactly for what Chris is saying. When you have someone apply for asylum or going through that process, you don't want them to tell the most traumatic story of their life with their kid in front of them, right? And so that is such a critical component, and so many of these other services that we provide at WIN. And so Morgan, could you share with our audience, what are some of those other wraparound services that people receive? And, we heard from Chris about childcare, dance, poetry. Are there other programs?
We also do yoga. In addition to the dance movement, we do have yoga programming as well. A lot of just working with the interdisciplinary team for different types of interventions based on the family's need, right? So crisis intervention, definitely we are starting a program also with the youth for dance movement as well. So not just for the adults, but for the youth as well to get engaged in those services.
And I just want to say that I hope you've seen the thread of movement. So many, 80% of our moms report having been domestic violence survivors. If 80% report it, it's 100, because people don't always admit it. And that physical violence, that mental violence that's directed at keeping you small and keeping you down, having places where people can literally move their body, literally just expand to the fullness of their being, and having children who do it, who love to move, but in many cases have been so confined, really makes an enormous difference. We also at WIN have a very aggressive job training, job placement program. And that goes hand in hand with mental health too. Because if you're suffering with mental health issues, okay, let's talk about how the job interview is going to affect you differently. Let's talk about what you can do standing on the street before you go upstairs to the first day of work. We can talk about how you can breathe, putting your hand on your belly, putting your hand on your heart. All of that is there in the mental health work, because we can't assume that someone who is a survivor of domestic violence, has been homeless, dealing with mental health issues they're going to feel particular things on that first day of work or that job interview that those of us who are lucky enough not to have all of those things happening to us may not experience.
And I think we have time probably for one more question, depending on how long the answers are to this, because I think it's a complicated question. For this, and I open this to anyone on the team that feels that they have an appropriate answer. Are these services that we've been talking about available to migrant families? And can you tell us more about their status and mental health services for them? Chris, you're muted.
Sorry,
I'll
let
let
me
Chris
just,
take it.
after 3 years of the Zoominess, you would not, I would know when I'm muted. But anyway, we are a sanctuary city, and we are a city where no one will ask what your status is. So if you go to Bellevue to the mental health clinic there, you will get services. No one's asking what your status is at a WIN shelter. That said, things that are federally funded, like food stamps, you can't get unless you have a legal status. And it's hard for people to have to go somewhere else when they're dealing with so much. So it is a complicated answer, but go ahead, Chris Mann.
Yeah, I was just going to say, these services would absolutely be available to migrant families, right? So, WIN has, around 250 to 270 families who came in on buses between last August and now. And all those families would have access to these on-site mental health services. And, I think, as we've worked with these families and we've heard their stories, just the immense amount of trauma that they've experienced at home, why they left, along the journey to get here, it just really highlights the need of these services even more so. I think the simple answer is absolutely these services are going to be available to migrant families.
And just on the last note, I just want Morgan, if you could just for a second just tell us about sort of from your experience on the ground, like what that has looked like, and what the traumas that these families are facing.
It definitely has it definitely has been very traumatic for our families when they come in to kind of tell these stories and retell their stories, right? So they're telling their story at PATH. Now they're coming into shelter, meeting with the case manager, telling their stories again. And it definitely has been a challenge in the sense of these families really having to transition and learn a new culture, right? Learn what it's like to be in the city where it's cold out. They're not used to this climate. So just kind of like learning the different systems, going to different appointments, having to retell the story over and over and over again in regards to like the severe trauma that they experienced, and for their children as well.
Thank you, Morgan, and thank you to our entire panel. We're out of time, but I do want to extend, the invitation to everyone here. Please, please, please reach out to us if your questions weren't answered. There was a few that we didn't get to as regarding the time today, but we would love to be in contact with you to get at some of those. If you're interested in supporting our mental health and wraparound services, again, no gift is too small. Camp WIN is around the corner, and it's designed through a trauma-informed care lens, as Chris talked about, and it's full of mental health support programs. Just to give you an idea, $100 will send 2 kids to dance workshops, $250 will send 5 kids to mindfulness classes, $500 will cover a therapeutic pottery making workshop for 10 children, or go big and support a well-being class for a site with $10,000. Please get in touch with our development team to provide you with more possibilities for impact. And please join our email list and follow us on social media platforms. We're really active, become advocates and supporters if you're not already, and more information will be emailed to you. And thank you so much for joining us this morning, for going over this really, really critical topic. Thank you, everybody.
Thank you.
Thank you.